are the benefits of PPIE? In a previous video, we looked at what PPIE is. In this video, we're going to zoom into its benefits. Now, PPIE stands for Patient and Public Involvement and Engagement, where involvement is when patients or people with lived experiences, their carers, members of the general population, are actively involved in the planning, designing, and conducting of research, while engagement involves the dissemination of research findings to the general population, their meaning and their impact. PPIE has benefits for the patients and the public, for the general quality and relevance of research, as well as for researchers. Let's look at the benefits for the patients and the public first. Firstly, it has the opportunity to influence research priorities by ensuring that the research addresses issues important to patients and not only important to us as researchers. It also empowers and leads to increased health literacy, where better understanding of the research processes and the methodologies leads to increased knowledge about a specific health condition. There's personal development and new skills because the patients and the public being involved in research undergo training in research methods often. They develop communication and advocacy skills and networking skills. There's also a sense of contribution to the healthcare improvement and a feeling of making a difference to future patient care. And it's an opportunity to give back to the healthcare system. And it has the potential to be therapeutic through this engagement. There's also financial compensation and recognition, where many PPIE roles offer payment for the time and expertise, and there's acknowledgement in research publications and presentations. There are also benefits to the quality and relevance of the research, in that there's more patient-centered outcomes, where the research focuses on outcomes that matter the most to patients. There's better alignment between research goals and the patient's needs. There's also an increased likelihood of research uptake. Findings are more likely to be implemented in clinical practice, and there's greater public support for the evidence-based interventions. There's improved dissemination of findings, where more effective communication of results to non-scientific audiences, and there's an increased public understanding and engagement with health research. The research are also more cost-effective due to the early involvement of patients and the public, which can prevent costly mistakes or irrelevant research and leads to more efficient use of research funding. If the PPIE principles are followed well, there will be diversity and inclusivity, which leads to broader representation in research, including marginalized groups. There will also be bridging between theory and practice, where our practical insights into implementing research findings will help with the identification of real-world barriers to adopting new treatments and interventions. There are also a number of benefits to researchers. Enhanced relevance and quality of the research, because through involvement of patients and the public, we ensure that the research questions address real-world patient needs. Improve study design by incorporating patients' perspectives, and it leads to a more appropriate outcome measures. Improved recruitment and retention of study participants. Patient input on the recruitment strategies can increase the effectiveness through more relatable study materials and communication, and a better understanding of the potential barriers to participation. Greater credibility and impact of findings through increased trust in research due to public involvement, and enhanced likelihood of research uptake by healthcare providers. There's also a stronger justification for funding and resource allocation. New perspectives and insights. PPIE challenges researchers' assumptions and biases and brings lived experience to complement scientific knowledge. There's also improved dissemination of results and wider reach through patient networks and advocacy groups. There are numerous benefits of involving patients, their carers, the public, people with lived experiences in your research. See how you can implement the principles of PPIE in your own study proposal and research projects.
If you found this video helpful, smash the like button. For more useful tips to boost your research experience, subscribe to my channel by clicking the subscribe button below this video. And while you're at it, hit the bell so that you get notified whenever I produce a new video. If you need a solution to a challenge not yet covered on my channel, leave a comment in the box below. See you in the next video.